I am the director of the Office for People with Developmental Disabilities, Office of Strategic Initiatives. Today, OPWD is here to share with you a little bit about our strategic plan and talk about the Office of Strategic Initiatives and our role in engaging in that strategic plan, which is really about engaging with stakeholders and making sure the work of OPWD is articulated to the public and shared in a way that allows for an ongoing process for communication, education, and input. In addition to that, we are joined by our employment experts at OPWD who will take some time to review some important work that's happening to really support the objectives and goals of the DREAM Symposium and talk about those activities and how we're really excited to be focusing on employment for all New Yorkers and engaging in that focus and goals and objectives to work collectively across our partners with our public to ensure and engage in employment for New Yorkers across the state. Today, I'll have Jessica Pigeon, who is Dr. Jessica Pigeon, Director of Strategic Planning in my office, the Office for Strategic Initiatives, provide an overview of the 507 plan. That process began in the summer of 2021. We went out to the public, engaged in 5 public forums. They were virtual given the pandemic, and really listened and heard from stakeholders across the state about what was important to them, where they see challenges and areas of focus that they would like the agency to engage and focus on. Following that engagement, we issued a draft strategic plan last spring. With that strategic plan, we tried to identify those areas that we thought we heard were most important, including workforce, employment, self-direction, and a few other areas, which Jessica will provide some information about. And following that draft release, we engaged again over this summer to say, hey, did we get it right? Did we hear what we thought we heard from the public? And does this revised draft strategic plan target and address those areas of focus? So our next phase is to really finalize that plan this November so that we can begin the process of driving towards the roadmap that we've laid out in that strategic plan and continue to engage with our stakeholders to measure, look at what we're doing, confirm it's right, where we don't have it right, take a step back, re-engage, and reestablish our goals and objectives. So again, Jessica Pigeon will be sharing information on the draft strategic plan, and then we'll be joined by Alexis Harrington, who is our Associate Commissioner for Program Implementation and Service Access. And from her team, Lim Thibdu will be addressing the State of the State Employment Initiatives, who's heading up that project and sharing some of the details on the employment efforts that OPWD is engaging with our partners to, again, ensure that we're creating opportunities for employment for people with developmental disabilities across the state of New York.
Thank you, Allison. Good afternoon, everyone. Excited to be here with you today to talk a little bit about our strategic plan document for the Office for People with Developmental Disabilities. The presentation from the 507, which is another term for our strategic plan, which is reference to mental hygiene law that requires us to submit that plan to the legislature. It's the section 507 of that legislation. So you'll hear 507 utilized, and you'll hear strategic planning utilized. They mean the same thing. But the presentation for the 507 specific side of things, I'll go over a little bit of what's in the draft document, which is currently available on our website. I'll talk a little bit about some next steps, which Allison kind of mentioned already, and then we'll shift over to employment-specific activities, which are a part of our strategic plan. So the current draft document, which is a 5-year strategic plan from 2023 to 2027, includes some specific information related to our planning process, all of the input that we received, which I'll provide more details on, that Allison noted, our actual strategic goals and objectives, a number of activities under each of those goals and objectives that are either currently underway or planned to be underway in the coming years. evaluation section, conclusion, appendices. And again, I'll speak to all of those a little bit this afternoon. If you haven't had an opportunity to review the draft plan yet, I encourage you to do so. You can find it on our website at opwdd.newyork.gov/strategic planning. So to prepare our 2023 to 2027 507 strategic plan, we invited input from a variety of different stakeholders across the state, including self-advocates, family members, organizations, providers, CCOs, and others in the spring and summer of 2021. We collected that input through holding 5 regional public hearings, all of which were virtual at the time due to COVID. We also held virtual meetings with targeted constituents and groups, which represented, again, self-advocacy groups, family organizations, provider organizations, different disability councils across the state, and also representatives from underserved communities and demographically diverse groups. We collected comments via email during that initial round and through our existing stakeholder committees and meetings, which meet on a regular basis, including our Developmental Disability Advisory Council. We also analyzed Medicaid utilization data for the state of New York and looked over a variety of different federal data points and trends, as well as staff stability data. And you'll see a lot about staffing in the workforce in this presentation and in our draft document. So through all of that engagement and the data that we analyzed, the following key priorities were repeatedly identified by stakeholders. The first was the importance of addressing the DSP workforce crisis that our state is currently facing, and I should say the nation is facing. The second is improving our self-direction model. The third is improving housing supports and services that we provide to people with IDD across the state of New York. The fourth is supporting people with complex needs better. The fifth was improving our use of data and transparency with our stakeholders around that data, and also supporting research of programs and services and being more innovative. Some additional categories that were highlighted include employment, which again we'll talk about more specifically today, the services that we provide to children, health, and also improving access to supports for those who come from underserved communities. Based on the input and data, we drafted the following 3 goals for our 2023 to 2027 draft plan. The first is to support people in the most person-centered ways. The second is to promote practices that strengthen the workforce and infrastructure of OPWDD. And the third is to advance systems change and innovation across the state of New York. As noted, Goal 1 focuses on supporting people in the most person-centered and holistic ways possible. To do this, our agency will like to improve supports and services for people with developmental disabilities throughout their lifespan by addressing gaps in services and ensuring supports are focused on individual need, that they offer choice, maximize independence, and increase community integration and participation. To help meet this goal, we will focus primarily on the following objectives. The first is community integration and participation, where we're seeking to increase opportunities for community integration and participation and supports that facilitate self-determination and activities that improve social determinants of health. The second is to ensure children, youth, and young adults receive appropriate and coordinated services within the context of the school, family, and community. The third is to expand and improve services targeted for people with complex support needs, including residential and crisis services and behavioral supports. And the fourth is to identify and address gaps in services and supports that meet the needs of underserved, culturally and ethnically diverse communities. Again, the full document has some very specific activities under each of these objectives that will help us meet the objectives and goals, so I do encourage you to review that if you haven't had a chance to. The second goal focuses on advancing the OPWDD system by investing in our workforce, updating our ITS infrastructure, creating opportunities to expand and be able to support our service delivery system and increase access to information. We'd like to do this by improving recruitment, retention, and the quality of the direct support and disability workforce in our state, We also want to advance our technology and information infrastructure so that we can increase the availability and timeliness of data so that we can use that to inform our decision-making and to monitor the performance and assess the quality of the services that we're providing. We'd also like to promote opportunities for stakeholders to inform our decision-making and build and strengthen our collaboration with other partners across the state. Lastly, OPWDD is interested in exploring new approaches and opportunities that advance the system, reduce the complexity of the services that we provide, and improve our responsiveness. To meet this goal, we're planning to strengthen the quality, equity, and effectiveness of the supports that we're providing. This includes our self-direction model, our competitive integrated employment services, our continuum of housing and residential options, and our care management services. We'd also like to increase opportunities to explore and implement regulatory and policy changes that support greater flexibility and also incentivize improved personal outcomes for those that we're serving. And lastly, we'd like to prioritize innovation. We'd like to do this by evaluating programs that currently exist that we operate, conducting research on new programs, and developing opportunities to test these new programs and test new service delivery. The draft document also includes a brief evaluation section and a conclusion, both of which speak to our plan to continuously share updates on our progress on meeting the goals and objectives that we've identified in our 5-year strategic plan, and continue to have those conversations with stakeholders on an ongoing basis to see how we're doing. Additionally, we've included an appendix within the draft document, which has a pretty extensive acronym list. If you have heard from others throughout the state, you've probably heard a number of acronyms already today, or if you visit some tables. So we do have one of those attached to our draft plan. We also have a more specific overview of the stakeholder engagement and what was shared with us in that 2021 cycle of stakeholder engagement opportunities. So the goals and objectives that we've identified and outlined in our 2023 to 2027 strategic plan, we believe provide a roadmap for stabilizing our service system in the short term, while also laying out important research, evaluation, and innovation activities that will inform ongoing system improvement and reform in the long term. We believe that our plan will assist us, alongside all of you and other stakeholders, to work together to achieve clear and planned progress on the system's reform and transformation, and that we can move together toward a more person-centered, sustainable, equitable, and coordinated system of supports and services for New Yorkers with developmental disabilities. Some of the steps that have taken place or are currently underway and planned for the immediate future related to our draft 507 strategic plan include us, as Allison noted previously, we released the draft document back in May and asked for feedback from all of our stakeholders on whether or not we got it right, like Allison mentioned. Following the release of that document, we provided several different opportunities for stakeholders to share their feedback on the draft. This included June, July, and August holding 13 in-person regional forums across the state of New York. We also held 4 virtual statewide hearings. We had 15 other in-person and remote targeted meetings with specific constituent groups. We allowed people to submit writing, or asked, people to submit writing via email. We received over 110 emails that were unique from people. And then we also created, this time around, a feedback form / survey that people could fill out to provide their comments and feedback on whether or not they agreed that we captured what they believe should be our priorities. And we did have over 450 people submit one of those feedback forms to us. So we had pretty extensive, I would say, stakeholder engagement on just the draft document itself. Based on all of that feedback, we do believe that a lot of what's represented in the draft document is in alignment with the goals and objectives of and the priorities of our stakeholders. You will, however, see in the final version, which will be submitted to the legislature and released publicly in November, so just a short few weeks away. You will see some added updates, so some additional content around some of what we're doing with our stakeholders, some of our existing groups, some more information about some of our processes. You'll also potentially see a reorganization of some of these goals and objectives and our priorities within the document. And then the document itself will look rather different. We're hoping to make it a bit more accessible, so it will visually look very different than the current draft version that's on our website that I mentioned. So with that, I'll pass it over to my colleagues to talk more specifically about some of the work we're doing related to employment.
Thank you so much, Jessica. So I am not going to take too much of your time because I really want to make sure that you can listen to Lynn Thibdu talk about the amazing work that she has literally been working her 32 years of state public service to work towards. So I wanted to do a brief intro because I'm just so incredibly excited and honored to be here. I think it was Commissioner Poole that had noted how overdue this is, and while I haven't been here as long as Lynn, I have been here since right before the pandemic, so I have been able to see that silver lining, the fact that we have been able to collaborate and move things through the bureaucracy so incredibly quickly because we needed to. So one thing that I wanted to say is before Lynn kind of goes down into all of the details that we've been working on and will continue to work on, is just to preface it with the fact that we have a trifecta here, which is so incredibly amazing and doesn't happen often, quite frankly. The fact that we have the leadership and support of the governor that has really highlighted the state of the state, highlighted that she wants to prioritize New York State as a model employer. So to somebody's earlier point about talking the talk and walking the walk, that's very much what we're doing today. So that first leg of the stool is that support at the governor's level. The second is having the relationships and the partnerships with stakeholders, and that includes folks in this room, really ensuring that we're taking a look at the existing policies in place, understanding where the barriers are, where the burdens are, where we can make sure that that one-on-one level personalized support can happen, because we know based on outcomes, that's where we have the most successful outcomes, is that personalized employment. And then the third leg of the stool, which is very rare that it happens to align, is actually having the fiscal, having the money to support this initiative. So, you know, those things don't align often, you know, kind of similar to the retrograde. It only comes, you know, every so often. So I very happily want to hand this over to Lynn Thibdu to share the details of this work that is underway.
Thank you very much, Alexis. She is very complimentary of me, but I'm going to tell you, she's done more work in her 3 or 4 years here at OPWDD than all the rest of us have done in 30 years. So she gets a lot of credit for driving all of these things through. She's a wonderful advocate for employment, and it's a pleasure always working with her. It's also nice to see everybody in person. You know, we've seen a lot of Zoom over the past couple of years, so it's really great to be here at this wonderful event. So I'm going to try this afternoon and talk for a few minutes about how these ladies gave you a wonderful overview of the 507 plan. I'm going to try and tie this together to employment. A lot of the goals that were up there are broad goals, but underneath all of them are a lot of elements of how we're going to help individuals with IDD become competitively employed. And a lot of that is also embedded in the system. How are we going to change the system so that all along in each of the services we're helping people gain independence and potentially get skills. So skills that will help them in employment. So I'm going to try and answer these questions here. We may have some time at the end for questions from all of you. If not, if you have a question, feel free to come on up and ask. So these are the three things I'm going to try and talk about here. How will we enhance the services to have more community engagement? How will we increase employment opportunities? And lastly, how will the governor's State of the State initiative, workforce development initiatives, how does that align with all the things that are in our in the OPWDD strategic plan? So first, we're going to try and, in order to increase community engagement and opportunities for people, I think we're going to remove this. Can I get this off of here? I move when I talk, so it's much easier for me to talk this way. So we're going to be trying to increase community engagement opportunities for people. The thought behind that is to help people become integrated into the community, to make friends, lead richer lives. And we are going to do that by trying to pilot with our providers, our very hardworking providers, some innovative projects. As you all know, the dehabilitation, a lot of our services with the workforce crisis that we have, some of them are back in operation. Some people are determining that they need other types of services or they're interested in other type of things. So we need new models. And over the next few months, we're going to be putting out requests for proposals to our providers to create those models, to pilot them and make suggestions so that we will learn from experience. And it's also an answer to what the needs of individuals are. So that can inform future plans. We're also going to try and help work with all our provider agencies, increasing the number of agencies or providers that provide a whole continuum of services so that individuals that they serve, if they're in dehabilitation, they might, and community pre-voc is an option, a pre-vocational service is an option for them, the same provider can give those services and help move people through a continuum of services so that it meets their needs, okay? They don't have to go seek another agency. So encouraging providers to give the full continuum of services is one of our priorities. Also, we are going to be working with our direct support professionals, particularly those that serve in DAHAB, and provide them with training opportunities to also help them be able to teach more basic life skills, encourage independence, and not be so thinking about recreational activities, although that will be a component of it. We're just trying to help help people get more independent, potentially to move to employment. Secondly, we're trying to increase employment opportunities. We're in the process of working with our providers to make some regulatory changes that will make it easier to provide the service, get rid of some administrative burdens, and really help them to be able to give the services to you and maybe not be bogged down in some administrative processes. It's also, OPWDD is looking at their whole service system in terms of trying to move people through the service system more quickly in terms of getting services, enrollment, eligibility, all those things. The commissioner has a major undertaking in trying to evaluate that and make sure that everybody gets the services that they need in a timely fashion. And lastly, we're going to look for our providers and their executive directors and leadership teams to look at their business model, again, to be responsive to the changes that need to be made and the changes in services, and also, to respond to the changing needs of the individuals that we serve. We're very excited. You know, one of the things, and Alexis mentioned it, we really are very excited because a lot of these initiatives have funding behind them. And in the last couple of slides, I'm going to talk about, you know, how that funding is going to work. But this is really, in all the time I've been working on this, this is, I don't want to say it's the first time, but it really is, there is a dedicated and a real commitment to funding these ideas and opportunities. So we, in the next month or so, are going to be issuing a request for application, really, for our providers to develop and deliver career-specific vocational training. We had identified this as one of the gaps in our services. We don't really have the ability to train people to be in a specific career, and I only use this as an example, maybe to train someone to be a cashier or something, and it's not limited to that. It can be any career, computer careers, such. But it will be, the providers will respond, and hopefully they'll be able to create and deliver training programs. Particularly, we're hoping to start with the number of the individuals that have lost their job. There's still 1,000 people in our services that lost their job during the pandemic, and they haven't returned to work. So hopefully it will help them, but it's not exclusively that group. It can be anyone in our services can participate in this. We're hoping to create marketable skills that employers need and want, and really it enhances everyone's resume to help get a job faster and maybe a better job, because you're moving in with a certain set of career-specific skills. We're also going to be developing supervisory and worker trainings. Again, Alexis mentioned that we are, Governor Hochul would like us to become a model employer, New York State to become a model employer. And in order to do that, there are changes that have to be made in our civil service structure and in our state workforce. We are going to be developing trainings in natural supports, reasonable accommodations, those things for the state workforce, to hopefully make it more inviting environment for individuals with all disabilities. So I mentioned the funding sources. So through the governor's State of the State initiatives in the workforce development, we have a little more than almost $28 million, which is significant. And we are going to use that funding to create business and culture business model and culture changes, the career-specific training, which I was just talking about, training direct support professionals, to help them help people to gain more independence and more basic life skills, and to offer more community engagement opportunities. We're also developing community-based services and try to reduce dependency on site-based programs. It may take time to do that, as sometimes some people like the site-based services, but again, getting people more integrated to the community, into community engagement activities is our goal. And then lastly, have New York as a model employer. So there's funding dedicated to each of these categories from that $28 million. OPWDD has also graciously provided $30 million in funding, and this is over the next, all of these things will be over the next three years or so, to pilot the programs I'm talking about in response to your customer needs and wants, and work with providers to create these services that meets people's needs. And then we're going to provide increased flexibility in the services that already exist, supported employment, pathway to employment, community pre-voc, and rehabilitation. And we're very excited about these changes. We think some of those things are also going to help us achieve all of our goals. I think that's the last of it, so thank you. If there are questions for any one of us that spoke, we'll be happy to take the questions.
For accessibility reasons, I'll just get a little walking and share my.
I have twin boys with Down syndrome that have been in your self-determination program for, well, one's been 6 or 7 years, the other almost the same. It's been a great program. It's been too good a program, and that's what's created the problem for us. Both of them are at the point now where they can no longer receive wage increases. They have to refuse bonuses because they're getting a wage that puts them above their SSI allotment, and so they're going to lose their SSI if they continue to accept these wages. So I'm wondering what your plan is. That's a federal program. I've tried to work with Schumer. I've tried to work with Gillibrand to no success at all. And I've also, looked like I was going to have success with Delgado, but then he got pulled away and he's now working for the state here. So nothing has come from his office or whoever took over for him. So it's a problem for us. It's a problem psychologically for them because they know that they're eligible for these, and then they see their coworkers get raises and they can't get them.
Is this thing on? Oh, perfect. So I just wanted to thank you for sharing that feedback with us. Oh gosh, am I too? Okay. Sorry, I've never used one of these before. So first, I wanted to thank you for sharing that feedback with us. I think that we have heard that before, and as you noted, with that being really a federal barrier, I think all that you can continue to do is educate all of us on these obstacles so that we can connect with our counterparts to just really share these real-time experiences that are happening. It's just, it's really just unacceptable, the fact that, you know, we're promoting and pushing for everybody to have equal access to opportunity, and with that comes the salary and the wages, and to have somebody with a disability having to decline a promotion or a salary increase is just completely unacceptable. So, you know, I think from our seats, we understand that that's a challenge, and I would just encourage folks to continue sharing that feedback with us so that we are able to coordinate and just continue elevating that feedback as appropriate.
I'm not asking that they be allowed to continue with all their SSI. What I'm asking is there a way to put a sliding scale in there? So if they make an extra $1,000 in a couple month period, then they would just reduce their SSI by that amount, so that part. So the majority of their annual income will come from their employment, but they still not to lose their SSI, because once you lose the SSI, you lose your Medicaid, and it's like a snowball effect. So that's one of the proposals that I thought might be something they'd be willing to listen to.
Yeah, that's really the problem with, it's not always the SSI dollars, it is the Medicaid that lose, and there are some programs, Medicaid buy-in and some things like that are potentially, you know, maybe seeing a benefits counselor is a good option. They may be able to help direct you in some of that to get maybe potentially Medicaid buy-in. It's very hard to answer a specific question because I don't know your circumstance, but maybe worth thinking about.
Thank you. Thank you for sharing again. I know I saw you in Binghamton too, right? For the forum.
I was just going to react. If individuals are individuals with disabilities and been working a certain number of quarters, then the federal government then declares you ironically, based on your son's disabilities, permanently disabled, which is a classification all in itself that should be changed. But then their actually earning income is higher. So we may also be able to help you look at how to move them from SSI to SSDI, that then allows them to have more income and accept those benefits and not be at risk of losing their Medicaid coverage if that's what they need, sir. So there's plenty of people in their hair, they're all shaking their heads. They'll all be over to see you probably at the end of the session.
Other questions or comments?
The 507 plan for the Office of People with Developmental Disabilities and the new 1115 waiver is, would you care to share what your hopes are as it relates to the great things that are being proposed in that, especially around the support cares services that I think employment fits in so beautifully?
Sure, great question. I think, one of the benefits of the 1115 public process was the outreach from the developmental disabilities community about the need to engage with DOH across our stakeholder community. Obviously, when we view the experience of DISRIP and what happened there, there really wasn't enough opportunity and engagement. So we're fortunate that the Medicaid director and our commissioner have been, in conversations, and we've really bridged some of that I think, gap, and have spoken to the 1115 opportunity in the final plan that you'll see out in November. The details of how exactly that engagement and partnership will be detailed throughout the next phases of the 1115 is under development, but we're encouraged by that relationship and that partnership, and we wholeheartedly, feel that taking opportunity there where we lost one previously is important, and we're excited about, next steps there.
Hi, I'm wondering if there are going to be any opportunities for vendors to become OPWDD providers who haven't been accepted as providers in the past, and what that process might look like, and if there's an RFP process.
Testing? Okay. Whew. That's a great question. So you might be aware, and you might not be, but there is a process outlined in our waiver related to, it's the LOI process. So essentially the regional offices need to assess whether or not there is a need for additional providers for particular service areas. So for the last few years, there have been a complete pause on that. I think if anybody is interested, your first reach out needs to be to the respective regional office to understand if there has been a recent assessment. But I will say, just kind of looking at the landscape of where we're going towards, they are going to be assessing that more and more, especially as it relates to employment supports. And Lynn really focused on establishing a continuum. So how do we get there? We really have to take a look at who's providing what currently and how to optimally meet everybody's needs. So great question. Start with your regional office, and there is a process in place that's highlighted in the waiver.
We're a little past time. We have one other question if you'd still like to share, and then we're happy to kind of step outside as the next folks come in if other people have questions that you haven't had a chance to ask.
Thanks. Okay, so real quick, I love this plan. I think it's wonderful, but I was just wondering if there's been any thought to the staffing crisis and, how that's kind of layering into a lot of the challenges that most providers are facing right now in just delivering services, let alone kind of moving to next level thinking.
So I think great question, and obviously as OPWD engages both internally and externally, the workforce challenge is always front and center. One of the things that we've highlighted in the final 507 plan is, some of that, the work around our workforce investments, our retention and recruitment efforts. But I think the other thing that we are really mindful of right now is, as we look at any of the strategies we've laid out, including this employment service strategy, how do we look at it through the lens of the workforce crisis? Obviously, if people are employed and employed independently, that reduces the need for staffing. So what a great opportunity to address our staffing crisis. You know, as we look at technology supporting individuals through remote technology, engaging people in the community as much as possible, that opens avenues for, you know, really recognizing the workforce crisis and acknowledging that we have to think about ourselves and our system differently, and we really have to reinvent how we view supports and services to, you know, ensure we have staffing for the most hard to serve and really support those individuals who can be independent and can be integrated in the community as much as possible. So I think, again, as we look at our strategies, it's always having the lens of, you know, the workforce crisis front and center, as well as our, you know, desire to think about underserved communities, to think about DEI and how that's also an underlying foundational element of any strategy we put forth. So thanks for that great question.
Thank you. So I think that concludes this session. Enjoy the rest of the your opportunities to listen to other folks here today.
Lisa Brown, and I am a program specialist with NICE, which is the New York Employment Services System. Our topic today is working while receiving public benefits and what you need to know, why it's a good idea. We are going to cover some basic information today about receiving public benefits and work incentives. But if you have specific questions about your situation that you would like to talk more about, please give us a call. You can send us an email or give us a call. This is my contact information on the screen. And at the end, we also will have additional contact if you need to reach out. The other thing that I wanted to mention before we get started is that we have some handouts that we wanted to share with you, and Andy Sink has the handouts. There are two sections. So one is the handouts for the PowerPoint, and the other page is a resource page. So some of the links in the PowerPoint go directly, you can use the handout resources for those links specifically. So I just wanted to mention that. In addition, for those of you that have specific questions about not only your benefits, but providers, questions about finding a provider to help you go to work, you can also reach out. We have information about resources and providers that you can, we can access that for you. So please don't hesitate to call us if you have some questions for us. The other thing I wanted to just mention is that for those of you that need this information, I am Caucasian female in my 50s, wearing an orange dress and a black sweater today. I'm very happy to be here at the Dream Symposium. I think it's a great, terrific symposium for us to be a part of today. So thank you for letting me be here to share information, and I look forward to sharing more with you. So these are the topics that we're going to cover today. We're going to talk about NICE, which is the New York Employment Services System. I don't like the microphone, I'm sorry. So we're going to talk about NICE, which is the New York Employment Services System. We're going to talk about why working is a good idea. Benefits basics, so we're going to go over again some very basic ideas about benefits and how they might be impacted when you go to work. We're also going to talk about health care benefits, so Medicaid and Medicare, and being able to maintain your benefits while you're working. We're also going to cover SSA cash benefits and work incentives that are associated with each of those benefits. So that includes SSI and SSDI benefits. Finally, we're going to cover Ticket to Work. We're going to go over just a little bit of a preview of what that is. And if you have questions at the end of our training today, please feel free to ask. And again, I want to just offer that we're always available by phone or email if you want to give us a call or send an email. So we're going to start with the New York Employment Services System, which we pronounce as NYESS, N-Y-E-S-S. We are a collaborative system with all of these state agencies that are on this page. Office of the Aging, excuse me, Office for People with Developmental Disabilities, the Office of Addiction Services and Supports, the Department of Health, the Commission for the Blind, and the New York State Education Department. Our primary partners are the New York State Department of Labor and the New York State Office of Mental Health. What is NYESS? NYESS is a statewide partnership and a resource for all things related to employment. It's a collaborative employment services case management system. It is a ticket to work, and actually one of the largest ticket to work administrative employment networks in the country. We're also a primary employment services data source. So as you come with questions about employment services, please don't hesitate to reach out. We can help you be a resource for those things. So the next section is switching gears just a little bit, but we're going to talk about why working is a good idea. So some of the things that are important to know about going to work if you're receiving benefits is that research has shown that it is a social determinant of health in a lot of different ways, including financial, physical, and mental health, but also a great area of socialization, meaningful activity, even improved quality of life. It also is typically a reduction in the need for interventions. And we have to be careful when we're talking about employment because sometimes we have biases. We come to these conversations with a bias in our head already about how things are, and they may or may not be. So we have to kind of weigh whether or not those things are based on a sound foundation. So working while receiving public benefits is a good idea. Not everybody needs to be a benefits expert, but there are some things that we should all know as we go into this process. Individuals will typically have more money in their pocket at the end of the day, and they're not going to be penalized for working while they receive benefits, but it's really important that you continue to let Social Security know that you are working and send in your wage information. Individuals will be eligible for free Medicaid in almost all scenarios, and we'll talk about that in a few more slides. The common trauma and difficulties associated with public benefits are real for people, and that needs to be a part of our conversations. So every social service agency has their own rules for eligibility, and sometimes it's tough to navigate, so it's really important to keep that conversation going. Also, there are many common myths about what happens when someone on public benefit earns wages, and those myths are not real, and we need to talk about those so that we can share the truth about what's actually going to happen when people go to work. So one of the most important things that we should know is about benefits advisement. And anybody who is receiving any type of public benefit, Social Security, but also food stamps, TANF, any of those types of benefits, they should be connected to a benefits advisement. And each situation and benefit is very different. And so it's important to be able to link someone to a benefits advisor so they can get the picture of what their situation looks like. One of the things about finding a benefits advisor is if you don't know somebody that you can talk to about that, give us a call, let us help you figure that out. We are a resource for all kinds of things, and that is one of those things. We have a list of providers we work with, and we can find providers for you if you need that. In addition, it's important to have a website that you can go to find out some information on your own. And again, if you don't have that type of information available to you, or you don't know where to go, reach out to us and we will help you find that spot. On our website, our public website page, under the Customer Resources page, we do have several types of specific disability type going to work benefit information for you. So it includes, we have an SSI calculator that we're using that you can also use that to determine SSI benefits. We also have various work incentive definitions and how to complete some of that information on our website. So a couple of things additionally about benefits is that SSI and SSDI are completely separate Social Security benefits, and they calculate wages in different ways, but regardless, either way, working is a good idea for individuals receiving benefits. Again, the wages have to be reported in all scenarios. One of the big things is people don't report wages and then they get into an overpayment situation, which is really critical for people. Also, if an individual earns enough cash for cash benefits to stop, there are ways for them to continue to maintain Medicaid coverage through the 1619B of the Social Security Act, and the other is the Medicaid buy-in for working people with disabilities. And we'll cover both of those in a few more slides. In addition, if an individual would like to save more than the allowable resource limits, especially for SSI benefits, there are ways to do that. And there's a couple things: achieving a better life experience, which is an ABLE account, and the other is a plan to achieve self-support. And again, those will come up in another couple of slides, but we'll talk about those in more detail. Okay, moving to section 3, we're going to cover healthcare benefits, and that includes talking about the Medicaid 1619B. This is a special Medicaid rule that allows an individual to maintain Medicaid coverage even if their wages are too high and they can no longer receive SSI benefits. If you're eligible for 1619B, it will be an automatic process. But you can alert Social Security by completing the template, which is linked here and also on our resource list. That is a template that just says, this is what's going to happen, this is coming up, I'm earning more wages, and I just want you to be aware of that. This form is also located on our website under the Customer Resources tab. To be eligible for the Medicaid 1619B, the requirements include that you must have been eligible for at least 1 month for SSI cash benefits. You would be eligible for an SSI benefit except for the earning, so you're earning too much. You are still disabled. You still meet all of the other eligibility rules, including that resource test that SSI requires. And you need Medicaid to work in order to work. And you have gross earned income that is insufficient to replace the SSI benefit or to provide Medicaid. So you're making enough money to lose SSI, but not enough money to get health insurance. The second savings program that we want to talk about is the Medicaid buy-in for working people with disabilities. And this program offers Medicaid coverage to people with disabilities who are working and earning more than the allowable limits, but it's also free. So you may have a gross income as high as $68,000 for a single person and $92,000 for a couple. You also may have non-exempt resources that do not exceed the buy-in level of $20,000 for one person and $30,000 for a two-person household. So to learn more information, here's the link for the toolkit, the Medicaid buy-in toolkit. That link is also on our resource page. And as for the other health insurance related to SSDI benefits, most individuals who receive Social Security disability also are eligible for Medicare coverage. Following the trial work period, individuals can continue to receive at least 93 months, which is 7 years and 9 months, it's a long period of time, of Medicare coverage. And that includes hospital insurance, which is Part A, and that's premium free. They can also receive the medical insurance, Part B, if they're enrolled in it, and the prescription drug coverage, which is Part D, if they're enrolled. After the premium-free Medicare coverage ends due to work, you can buy continued Medicare coverage for as long as you remain disabled. Take a quick drink here. Yes. For the Medicare? So it's just individuals who are receiving SSDI. It is not related to retirement benefits, SSD. So there is no specific age limit. I think once you become eligible for retirement benefits, though, it may change the focus of that.
I think that's 65 and up.
Okay. Okay, we're going to move to the next slide. We're going to talk about the SSA cash benefits. So right now we're going to focus on SSI. So SSI program provides a cash benefit payment to people who have limited income and resources. The resource limits in 2022 are $2,000 for a single individual and $3,000 for an individual with a spouse. There are several SSI work incentives that you can use during this period. The student earned income, the impairment-related work expense, and the blind work expense. So the student earned income exclusion allows a person who is under the age of 22 and regularly attending school, but they are allowed to not count some of their earnings. So they're under 22, they're working full-time, or they're working, and they're going to school, and they don't have to count some of their earned income. In 2022, that amount can be excluded is $2,040 per month, up to a yearly maximum of $8,230. Did you have a question?
How would they be able to afford that? How would they be able to get transportation to work if they couldn't afford to buy a car? So I think this, I'm thinking about Japan and what they provide. They really don't have limits. People can work and they can earn whatever they want to. But in America, we provide limits on what people can earn. It really impacts what they can afford. They can't afford to buy a house or to buy a car. So we limit individuals here. I don't really know why we do that. It doesn't make sense, the system that we have, limiting people how much they can earn and extending this way for such a long time. Cost of living goes up, but our earning potentials don't always go up, and the system we have doesn't go up. So I don't understand why we still have the system that we do.
Yep, I agree. That is exactly right. The limits for Social Security goes up some years, but this 2,000, in the SSI limit, resources limit, 2,000, that has been that way for a long time. So that it's not really affected the cost of living raises.
It doesn't even compare.
Yes. The IRWE, the impairment-related work expense, is a work incentive for people that have costs for items or services that you need in order to go to work because of your disability. And Social Security will deduct the cost of the IRWI from your countable income when they determine what your eligibility is for SSI benefits. In addition, not on this slide, but the blind work expense, that is also available for individuals who are receiving SSI benefits and they want to go to work, and it counts as any type of service or item that they pay out of pocket to go to work. So it's not even blind specific, it is just in general to go to work. Now we're going to change our focus to SSDI, and SSDI is a cash benefit for individuals that have worked and paid SSI into the SSI insurance program. So when you work, you earn credits, and if based on the number of credits you've earned and the wages that you've earned over the years you've worked, that determines how much money in SSDI benefits that you receive. And there are several work incentives available for individuals who receive SSDI and want to go to work. The first is the trial work period. The extended period of eligibility is next, and followed by the expedited reinstatement. So the trial work period allows you to test your ability to go to work for at least 9 months without losing your SSDI cash benefit. So during this period of time, you will receive your SSDI cash benefit regardless of how high your earnings are, as long as you report your work activity and you continue to have a disabling condition. Your trial work period begins when you earn over $970 per month. So let me just say that every year that $970 is called the trial work level, and every year that changes. And during that 9-month period of time, if you work over $970 in 2022, then that month counts as a trial work month. If you earn under that $970 per month, then that month will now count as one of those 9 months of the trial work period. So overall, you have 9 months to try working, and it doesn't matter how much you earn, but it depends on how much you earn when you count the number of months that are equal to that 9-month period. Yes? So the 970 is the trial work level that only happens during the trial work period, during that 9-month period. The substantial gainful activity is 1350 this year, and that is after the trial work period ends. Then we start looking at the substantial gainful activity, which is 1350. Good question. So following the trial work period, we begin the extended period of eligibility. And after the 9-month trial work period is over, this extended period of eligibility automatically kicks in. And it is a 36-month period of time where you will receive your SSA cash benefit for all the months that your earnings are below SGA level. If you continue to have a disabling impairment. So this is where that SGA kicks in. During this extended period of eligibility, if you earn over $1350 per month, you will not receive your SSDI cash benefit. But if you work under the $1350, you will receive that cash benefit. The next work incentive that we're going to talk about is expedited reinstatement. And this is a safety net for people who are successfully returning to work and their SSDI cash benefits are terminated. So if your cash benefit payment end because of your increased earnings, and then within 5 years of your earnings, they fall below the SGA level, then you can request the expedited reinstatement of your benefits from Social Security. So one of the important things about this is that at the end of this period of time, or as you're getting ready to consider doing the expedited reinstatement, you have two choices. You can ask Social Security to do this expedited reinstatement based on your continuing disability, or you can file a brand new Social Security disability application. Okay, this next area that we want to cover is being able to save some money. So achieving a better life experience is the ABLE account, and that's a savings account program for people with disabilities who have resources that would make them ineligible for other benefits. So using an ABLE account to pay for medical and living expenses in order to maintain your health, your independence, and the quality of life. One of the things that, an example of this might be if you receive an inheritance and you receive SSI benefits and you know that they consider resources for SSI. So if you open an ABLE account and you put the inheritance in an ABLE account, you can still use that money for medical and living expenses, but it's not going to count toward your resources. The plan to achieve self-support is called a PASS plan. And the PASS plan allows you to set aside money other than your SSI benefit for a specific time period to reach a specific work goal. So let's say you have a specific work goal in mind, and in order to do that, you need to save some money. So perhaps you need to buy a car or you need to go to school. And you can set up the PASS plan with Social Security to save money toward achieving those things. Okay, and our last topic today is Ticket to Work. So Ticket to Work is an employment program through Social Security that can work in coordination with your existing supports. So through the voluntary Ticket to Work program, you can find providers to help you obtain and maintain employment without any cost. So it's free of charge for you to go through the Ticket to Work program. You're eligible for this program if you receive SSI and or SSDI benefits. You have to be between the ages of 18 and 64, and your goal is to go to work. So that's the requirement. One of the benefits of using the Ticket to Work program is that Social Security will suspend what's called the Continuing Disability Review, the CDR, as long as you are continuing to make timely progress during the Ticket to Work program. Your employment provider can assist you to prepare for, obtain, and maintain employment. So those services would include things like interview practice, practicing for the upcoming interview that you might have, maybe revisiting your resume, updating the resume. It could also include job search, and then once you receive your job, then it would be including job coaching services to help you maintain your job. Your employment provider can offer benefits advisement so that you can better understand how working will impact your benefits. So it's really important to get connected with a benefits advisor so that you know that ahead of time. Going back to work, you already know what to expect. And this is the end of our presentation. If you have any questions, please remember NICE is a resource for all things related to employment, and we would encourage you to give us a call or send us an email. Andy Sink is the Director of Employment Policy for NICE, and there's his contact information there. Thank you very much. Yes?
Do you ever go to local Department of Social Services and counties to explain stuff to them so that they are more aware? I've gone to get help through local social services, and when I told them that, I utilize like some of these programs, they act like I'm dumb or something. Like, what the heck's that?
You can go to your local independent living center, and they have resources there that you can talk with. People there are very well versed in the benefits and can help you with that. And we work with deaf people all the time around their benefits and employment.
Because my local Department of Social Services are so dumbfounded. I try to go there to help myself and other people. And
Don't mess around with them. The Centers for Independent Living sometimes are better resources. It sometimes can be a very complicated system. independent.
Thank you, that is helpful. And that is a concern, because as we talked before, every agency has their own set of rules, eligibility rules, and it's difficult to navigate that. So thank you for that question. Yes?
Medicaid buy-in.
The 1619B is premium free for Part A. I'm sorry, I got that confused. So 1619B is premium free. It automatically kicks in after you earn more money than the resource limit or the income limit. The buy-in is a premium that you would actually buy into purchasing that insurance.
So 1619B will kick in benefit drops to zero. So you'll keep Medicaid from that. Okay? Medicaid, right, it's because you're no longer receiving a cash benefit. It's supposed to be automatic, and it'll turn on. Medicaid buy-in, you apply for it separately from that to pay that. Yeah, so it's intended to be automatic by the Social Security. For everyone. So you're receiving SSI. You earn enough money for your tax benefit to go to zero. Your Medicaid, what's called 1619B of the Social Security Act, allows you to keep your Medicaid for free, even if your earnings drop your benefit to zero. Okay, so it's not a separate application. We do have a template letter that you can use. Make sure you let us know that that's happening now, just to make it work, right? Medicaid buy-in is a separate application. Right.
What about when people say they got kicked off at the site? They lost the
Right. Well, so that depends on the situation. Right? So being kicked off of SSI usually means that either no longer meet disability or financial requirements for the program. That's earning resources, etc. Right? So it depends on the situation. If it's due to earnings, if you lose your, if they lose their Medicaid, it would be because they no longer not direct and they also have resources from Spotify $2,000 per individual.
Okay, that makes sense.
Yeah, and for like there are multiple paths through that, so that's where the benefits advisor comes in. Right.
No, that's okay. Yes.
Yeah, I work at the regional center. Are you refer to the advisors and meetings that I offer advice. We see the list for now of all the certified exercise down that list. Okay.
So we work with Cornell also. So the contact information that's on the screen, and Lisa or I will help find. Yeah, I mean, part of it. The good thing about New York is there are multiple ways to get benefit advisors. Not necessarily technical, right? One of the things we're doing is centralizing different types of benefit advisors. But in the meantime, just reach out. We'll all be figuring it out.
Yeah, we don't
And just to include something to that, Social Security has work incentive liaisons, and they can you can contact them as well, and they're the benefit advisor for Social Security. And I have a list on my desk, so if you want to send me an email, I'd be happy to send you that for your area. Yeah. Any other questions? Yes.
So, I need to get to work. I now have Medicare for 7 years. Medicare doesn't cover it. So if I wanted to buy in for Medicaid, can I do that? And if I do, will that impact my premium for Medicare? Because I know of some counties where if you have Medicare, you don't pay for Medicaid, you don't pay for the Medicare premium. How does that work with somebody who's denied my income? I am paying my premium every 3 to 4 months. How does that work?
So as I mentioned, every situation is a little bit different, and so a benefits advisor would be able to lay that out for you specifically. In general, I can say that you're correct, it's complicated, first of all, and that yes, through Social Security, some individuals are able to get their premiums paid for through Social Security. And so that wouldn't necessarily be a problem. But again, it's individualized. We have to kind of take a look at all of your specific information. So I guess my best advice would be to talk to a benefits advisor who can actually lay that out for you in your scenario.
Yeah,
Do you have someone you can talk to?
I work for Access to Independence of the county. I have a certificate. Actually, my goal is to actually.
Oh, great.
But somebody who's been on Medicare for 12, 13 years,
Yeah.
I've never heard of the buy-in.
Oh, okay.
I've never heard of it until now.
Yeah.
Because I've married the entire time I've been I've always paid my So I was just curious.
That's a perfect example of the Medicaid buy-in not being, it has existed for a long time, but it's not well known enough for somebody like you who was like, oh, that would make sense for me. I didn't know about it. That's too bad. That's unfortunate for us as a system, but for that not being but it's free. And now that I know, right, push it to the agency. Right. And your benefits advisor that you're working with, if they didn't bring that up, that's a problem also. I'll give you a perfect example. I had to apply for Medicaid buy-in just so that I could receive tax service. Otherwise, I'd be SOL. So, the buy-in, frankly, is one of the best kept secrets in terms of the disability.
Yeah.
And it's part of, and Kim, Hill, and her team, and us have been talking a lot about that, about how to market it better. And so, you know, two things with it. One, the cap needs to be raised. Okay, that's one thing that you know is not under our control. Or one thing that is under our control is our ability to market it and get the word out. And that's part of what's happening right now. So that's great. Spread the word.
Yeah, definitely.
Absolutely.
Yeah. Okay. Well, thank you all very much for coming this afternoon, and I hope you have a great rest of your afternoon.